The first question I ask the patient is, which way do you want to take the drug? What way makes the most sense for you in your life?
The fears and the anticipation of using a self-injector stop a lot of people because they're afraid of needles or they're not sure what might happen.
Hi, for CreakyJoints, I'm Seth Ginsberg, welcoming you to another educational video. Today, all about auto-injectors. See, there's a lot of information out there regarding these self-injectable biologics. But at CreakyJoints, as you know, we've been able to put together in the most authentic way possible this information and distilled it to what you need to know. You may be asking lots of questions of your doctor, of your family and friends, of other CreakyJoints members and their experiences using these biologics. Today's video hopefully will serve to help you along this decision-making path, giving you an example of what these self-injector or auto-injectors are all about, and allowing you the opportunity to understand which one might be best for your lifestyle. You'll meet experts including a physician, a health psychologist, and of course patients, talking about their experiences using these various biologics. We hope that through this video, you'll be able to make a more informed decision, you'll be able to have a more informed conversation with your doctor, and ultimately, you'll be on the path to a better treatment protocol because you'll understand that these self-injectors, or these auto-injectors, aren't anything to be afraid of, but instead something that you can incorporate into your lifestyle to make you feel better. And while you'll understand more about the mechanics of how these auto-injectors work, what's involved in the process, and which one might be best for your lifestyle, we want you to stay engaged with our community because we know that that's just half the battle. Sometimes having the medication paid for by insurance, dealing with prior authorization and other issues are all reasons we'd like you to check back on the CreakyJoints.org website and stay in touch with us. But for now, we want you to hear from the experts and we want you to understand exactly what options are out there to treat your rheumatoid arthritis.
Hi, I'm Dr. Lori Ferguson and I work with the Global Healthy Living Foundation as a health psychologist. I work with also private patients who have chronic diseases. So I've been involved in healthcare and sort of the motivation towards healthcare for a number of years. There's a lot of advice that says talk to your doctor. Talk to your doctor about what you're afraid of. Talk to your doctor about what the implications are of getting on a biologic, and I think that's really important advice. I also think it's important to find some support around that. Your doctor really becomes your coach, and your doctor is your trustworthy one that can help point the way, but you need other people too. You really need a team. So I advise people to also talk to the nurses in the office to see if there are possibly support groups, if there are even online communities that they could join, like ours, which is CreakyJoints, where you could put it on the message boards and get feedback from other people. Get as much information as you can. Your doctor's obviously the first one, but then you spread it out. Once you do talk to all these people, you find out it's no big deal. It's really just getting started, getting yourself in motion. That's the key. And sometimes to find some people who've already done it, that's the most encouragement there is.
I'm 29 years old. I'm from Florida. I live here in New York City now. The SmartJect really has changed things. Initially, I was on different types of medications that just weren't as effective, and with the SmartJect, my arthritis really doesn't affect me anymore. It's something that I don't think about on a daily basis. It really makes it much less of a big deal taking your medication. It's just a quick sting and it's over. It's a very quick process. You don't have to worry about positioning the needle or any of that sort of thing.
Well, that's one of the wonderful things about self-injectors, and that's you're taking your treatment home. Most people have to make that shift from the expectation that the physician, the nurse, the healthcare clinic is going to be the place that's going to take care of them. Of course they do, but what we're seeing more and more is that people who have the illness are expected and invited to take responsibility and then get that sense of being in charge of how their treatment works.
I'm Dr. Reddy. I'm a rheumatologist and I work here at NYU Hospital for Joint Diseases at the Seligman Center, where we do a combination of clinical trials and private practice, taking care of patients with all kinds of arthritis and autoimmune conditions. The technology in the way we deliver these types of biologic medications has also advanced recently, and we now have different types of auto-injectors for the different biologics. And this is an example of one of those auto-injectors used for a biologic medication. And the injectors have now come in a way that makes it easy for patients to administer to themselves, for people that have trouble using their hands, as it often is in the case in rheumatoid arthritis, and even for people that have fear of using injections, because these auto-injectors actually hide the needle and you actually never see it. So it makes it easier to overcome that fear of using injection medication.
Being in the driver's seat of the treatment can be a little daunting at first. I've worked with some people for whom that's scary, but that's the first step, or the anticipation. And then when they actually take it, there's a lot of freedom and there's a sense of power and enjoyment, really, to being the one who makes the decisions.
I'm Dr. Charles King. I practice in Tupelo, Mississippi. I'm the senior rheumatologist in a 3-man group. Pain, stiffness, and swelling are really the hallmarks of early onset rheumatoid arthritis. And over the last several years, we've really seen the development of a class of drugs called biologicals, which have revolutionized the treatment of rheumatoid arthritis. There are multiple mechanisms of delivery. One is the subcutaneous route of administration, where a patient actually administers themselves or has a friend or physician office administer the drug for them with a needle into the skin. The second method is an intravenous infusion, so a patient has to come in, have an IV started, and sit for anywhere from 1 to 4 or even 8 hours in some cases to have these drugs infused. And the first question I ask the patient is, which way do you want to take the drug? What way makes the most sense for you in your life? So if someone travels a lot, or they're a very busy person who's constantly on the go, it may not make sense to come sit for 3 or 4 or 5 hours doing IV infusional therapies. So younger, more active patients will often choose to take injectable rather than infusion drugs.
I think the fears and the anticipation of using a self-injector stop a lot of people because they're afraid of needles or they're not sure what might happen. And so it's getting people through that first step, or sort of over the hump, to try something new, to be in charge, and then the experience, when they get used to it, it becomes second nature. It's like when you are starting to think about learning to drive. The car seems overwhelming, all the things you have to do, and then when you practice it a few times, you become comfortable, you become at ease.
There are some patients who absolutely cannot or absolutely will not take or give themselves injections. They're either afraid of needles, there's a lot of needle phobia around, or they simply cannot because they have deformities that will not allow them to use injection methods. And those patients, we use infusions.
I've been on biologics for about 5 years. I came here today to have Emily give it to me because she doesn't hurt at all. And my hands are bad now, and I can't do it myself. And my husband, I don't want to give it to me because he has tried, and has his arthritis in his hands too. Luckily, she doesn't have arthritis in her hands.
Since she does not have a lot of extra subcutaneous tissue, I have learned, and I have had feedback from my patients that say that if they can have it in their upper hip, it does not hurt as bad when it goes in.
And very clearly, patients who ask a number of questions, do homework, learn about the side effects of their drugs, and partner with their physicians, taking an active role, are much better able to handle the ebb and flow of rheumatoid arthritis than patients who are just passive about the process. It takes a little more time, but in the end it pays far greater dividends, and I think patients truly enjoy that process much better.
One of the great things about the CreakyJoints community is we really want to support people in finding the best ways to live healthier lives. And that's why we're doing this, to bring the information, to help you learn some things, get some new ways of thinking, and hopefully motivate yourself to take that first step towards a healthier and pain-free life.
So there you have it. All there is to know about auto-injectors. Hopefully after today's video, you'll be able to go back and talk with your doctor, talk with your family and friends about what you've learned here and some of the ideas that you may have about which auto-injector or which biologic might be right for you. All of us at CreakyJoints wish you well and hope that you feel good real soon.